today with us from Nebraska, Dr. Jesse Bell. He is the Claire M. Hubbard Professor of Health and Environment in the Department of Environmental, Agricultural, and Occupational Health at the University of Nebraska Medical Center. His research explores the relationships of climate and extreme weather on natural and human processes. He served as a lead author for the U.S. Global Change Research Program report, The Impacts of Climate Change on Human Health in the United States, a scientific assessment, that was released by the White House in 2016. Before coming to UNMC, Dr. Bell developed a joint position between the Centers for Disease Control and Prevention and the National Oceanic and Atmospheric Administration. In this role, he led and coordinated a variety of climate and health projects. He also served on the White House OSTP Pandemic Prediction and Forecast Working Group. Dr. Bell is a Dougherty Water for Food Global Institute Faculty Fellow and Adjunct Faculty for the Department of Environmental Health at Emory. His PhD is from the University of Oklahoma, and he is my former neighbor, and we miss him since he's left for Nebraska from Atlanta. Dr. Bell, I'll turn it over to you. Thank you so much for being here.
Thank you. And I definitely miss Atlanta quite a bit. But we definitely have some beautiful things out here in Nebraska. And I'll talk a little bit about Nebraska and a little bit about the impacts of climate change on human health, especially focused on the extreme events. So one of the things I wanted to start off with was just defining what the difference between weather and climate is. It was attributed to Mark Twain, where he said that climate is what you expect, weather is what you get. So weather is the current conditions outside right now. Weather is extremely variable. It can change throughout the day. It can change from one day to the next. And climate is the behavior of the atmosphere over longer periods of time. So climate is, like the example is, seasonal. Seasons are climate. A year-to-year variation is climate. And the way that we look at what is happening here in Nebraska versus Florida or Georgia over the entire year, that is climate as well. But any particular event could be different. So, we can see a singular event here in Nebraska being much warmer or more humid than Georgia, but if you look over the entire summer, over the entire year, Georgia would probably be much warmer and much more humid. So we have climate change and climate variability. And this sometimes people get a little bit confused by as well. So climate change is a long-term continuous change in the average. And that's what we're seeing here with our, with this graph that we're seeing, where you're seeing an increase in temperatures going back from the 1950s to 2015. And then you have climate variability. This is the fluctuation above and below the average. And so this is a reason that we don't just get a steady increase in temperature from one year to the next, but we see a lot of variability over that time period. And there's a number of different factors that are interplaying to cause all that variability from one year to the next. And that can be everything from changes in ocean temperatures and ocean oscillations to Arctic oscillations. There's so many different factors that are interplaying there, and there's a lot of complexity in our atmosphere. And one of the examples here is El Nino, and I'm sure some of you have heard of El Nino, La Nina. Basically, a very brief definition of, or description of what it is the equatorial region on the Pacific in the ocean. Sometimes the temperatures are warmer on one side of the Pacific Ocean. Sometimes the ocean temperatures are warmer on the other side of the Pacific Ocean. And those shifts that occur in ocean temperature along the equator in the Pacific are El Nino and La Nina. And occasionally when they pop up and you see that fluctuation or that shift in temperature, it changes the climate system for the entire globe. And so here with this particular graph, you'll see the blue periods, the blue bars, are La Nina. And the red bars are indicating El Nino. La Nina is basically the global temperatures are a little bit cooler. La Nina, or El Nino, the global temperatures are a little bit warmer. And even though there's this general fluctuation that's occurring, you still see an increase in temperature over time. And so this is one example of how complex our Earth system and our climate system is, and why we don't see this general increase in temperature over time. And so that's one of the things I really like to try to point out. My background, a lot of it is in climatology. So if I don't talk a little bit about climatology, then I'm not doing you justice. And then we also have extreme weather. And this is going to be a major focus of my lecture here, is talking about extreme weather. And extreme weather is basically a phenomena that is outside the historical distribution, the climatological historical distribution. And so when we think of extreme weather, we think of flooding rains, heat waves, droughts, very severe storms. And so that also interplays in the impacts that we see across the globe. And I'll talk about that here in a second as well. But before I do that, one of the things that I really wanted to discuss is a little bit of the history of climate change. Because a lot of times when we talk about climate change, we talk about it in the context of what's been happening in the last 5 years or the last 10 years. And sometimes it starts to become more of a political discussion or a discussion of when it hit the news cycle. But one of the things that I always like to point out is that science evolves upon science. And so I think Isaac Newton said it best. He says, "If I have seen further, is by standing on the shoulders of giants." And basically what he's saying is anything that he discovered or he created as a scientist was because of somebody before him. And that's the same thing in climate change. The things and the concepts that we understand about climate change are because of other scientific advancements that have happened over time. And I'll talk about that here in just a little bit. So typically when I talk about climate change, and especially the relationship of our Earth's climate with greenhouse gases, I like to bring up these three individuals, Fourier, Tyndall, and Arrhenius. And one of the things that you'll notice is the time periods here. So Fourier was around the early late 1800s. Tyndall was in the mid 1800s. And then Arrhenius was around the turn of the century, around 1900. And we understand the basic premise. Most of us probably understand the basic premise of the greenhouse gas effect. We've been learning about this ever since we were little kids in science class in elementary and high school. And basically the premise here is that the Earth's surface absorbs solar radiation, and that increases temperature, and infrared radiation is emitted back out into the sun. And the reason that we have an increase in temperature is because of these gases in our atmosphere. Water vapor, ozone, carbon dioxide, nitrous oxide, and methane. And the whole premise came about because of these three individuals. So what was happening back in the 1700s was Fourier was looking around, and they were able to calculate how much radiation was coming in from the sun. And he was running the calculations, and he was able to figure out how much radiation was going back out into space. And when he ran the calculations, he realized that the Earth's temperature should be much cooler than what it was. And so he realized that there must be something that is trapping that outgoing radiation. And it wasn't until Tyndall came around the mid 1800s that they were actually able to determine that there are certain gases that can trap radiation. And those are the greenhouse gases that we're familiar with. And then around the turn of the century, Arrhenius came along, and each of these are mathematicians, scientists, chemists. And Arrhenius came along, and he was in Northern Europe, and he saw all this coal burning and going up into the atmosphere. And he realized a lot of that was burning and going up in the atmosphere was actually CO2, carbon dioxide. And he knew that that was a greenhouse gas and it should trap outgoing radiation. So he started running calculations around the turn of the century and was able to actually determine that with an increase in CO2 in our atmosphere, we should see a progressive increase in temperature. And so this goes all the way back to around 1900. But we weren't actually able to measure what was going on in the atmosphere until this person, Dr. Charles Keeling. Keeling had this great opportunity as a new scientist. He just got out of grad school. He moved down to Southern California, and they basically told Keeling, have at it. We want to know what's going on in the atmosphere. How do we measure it? Can you figure it out? And so Keeling had all this opportunity to really explore this. And one of the things that he was first able to do was start measuring carbon dioxide in the atmosphere. And the first thing that he discovered was this, is that in the Northern Hemisphere, during certain times of the year, greenhouse gas emission or carbon dioxide decreases. And other times of the year, you see a progressive increase in CO2. And what's happening here is basically the Earth is breathing. It's breathing CO2, carbon dioxide. And that's because of photosynthesis. Plants growing, greening up, taking, as you remember from your early biology courses, taking in carbon dioxide, and they're emitting oxygen. And so basically the Earth is breathing in some capacity. But then the next thing that Keeling discovered was that every year when he was taking measurements, that the CO2 concentrations in the atmosphere continuously increased over time. And so this station here in Mauna Loa, Hawaii, when they started taking measurements back in the 1950s, Keeling's measurements, moving forward, every year they've been seeing a progressive increase in CO2 concentration in the atmosphere. And as you can see, we just continue to see a progressive increase in CO2. And now when Keeling first took his measurements, they were around 300 parts per million, and we're well above 400 parts per million. And using some of these same ideas and concepts, one of the things that we can do is model it moving forward, similar to the way that Arrhenius started doing equations back in the turn of the century. We understand the physics of the atmosphere, we understand the physics and the chemistry much better than they did then, and we're able to use complex mathematical models to understand how changes in CO2 over time will cause a continuous increase in temperature. We're also able to look backwards based off of things like the Vostok ice core and look at how changes in CO2 concentrations in those ice cores and other cores that we're taking, how changes in CO2 concentrations line up with changes in temperature. So here with the Vostok ice core, which goes back over 400,000 years, when CO2 concentrations were lower, temperatures were lower, and then when CO2 concentrations got higher, temperatures got higher. And one of the things that you should notice is over that 400,000 year period, CO2 concentrations never got above 300 parts per million. And today we know that CO2 concentrations are above 400 parts per million. And where is that change coming from, especially over such a short period of time? Well, a lot of that we know comes from fossil fuels. We can determine this by a variety of different ways, but one of the ways is that you can look at the isotopic signature of a carbon molecule, and the isotopic signature of a carbon molecule coming from fossil fuels that's stored underground has a different signature than carbon that we see just naturally occurring in the atmosphere. And we've seen a shift and change in those fossil fuel isotopes in the atmosphere over the last 50 to 100 years. So what do we know about our climate system? And some of this has already been covered. We know that the temperatures have changed. We've seen an increase in temperature. We know that it's not necessarily homogeneous on how the temperature has changed across the globe. Certain areas have gotten warmer. We've even seen certain areas cooling, and there's a variety of different reasons for that. But again, it goes back to the complexity of our Earth system itself. But for the majority of places, the Earth has increased in temperature. But not only has the Earth's temperatures increased, we've also seen changes in a lot of other things, including precipitation. And so, like for here with the United States, you see, we've seen an increase in precipitation, especially in the central and northwest or eastern part of the United States. And we've actually seen it getting drier in many parts of the western part of the United States. And we also, based off of some of those models that I was talking about, similar to what Arrhenius did, we can actually project this forward and try to figure out how temperatures are changing moving forward. And we expect that temperatures will continue to change and continue to get warmer across the United States and much of the rest of the world as well. And we also expect that precipitation will continue to change as well. Here in the US, we expect winters, especially in the northern part of the United States, to get wetter. And during the summer, for a large portion of the middle of the United States, we expect it to get drier. And in the spring, in the southwestern United States, we expect that to get drier as well. So potentially more droughts and more opportunity for flooding rains. And like I was saying, and this lecture is going to be focused mostly on the extremes. Even though we're seeing these changes in the average, we're also seeing changes in our extremes. And so the hottest day of the year is expected to get even hotter. The wettest day of the year is expected to get wetter, so more chance for flooding rain. And the long spell, the drought spells, the dry spells, are expected to get even longer as well, especially in the western part of the United States, which means for more opportunity for drought events. And that's what we're already seeing here in the United States. We're already seeing a lot of these changes across the US. This figure just kind of illustrates that to some extent. You know, we've seen a rise in temperature. We've seen more extreme precipitation, especially in the Midwest and Northeast. We've seen more flooding, especially again in that Midwest Northeast region. We've seen more hurricane intensity and frequency, especially the large category storms. We've seen sea level rise, over 8 inches in the half century, and especially in the Gulf Coast. We've seen winter storms actually become more frequent and intense. And I talked about that just a little bit ago, about how we're expecting winter precipitation to get more intense, or more winter precipitation moving forward based off our climate models. And that's one of the things that we're already seeing, is that we're seeing an increase in winter precipitation, especially over the last 50 years. We're seeing droughts are increasing in intensity and frequency in the West, which we're kind of expecting moving forward as well. And then we've seen heat waves becoming more frequent and intense. And we've also seen wildfire season starting earlier and more burning across the US as well. And these same patterns are being seen in other parts of the globe. We're seeing this not just in the United States, but we're seeing this throughout all other countries, some sort of change in our climate system. So how is climate linked to our health? We've understood for a long time that climate has a direct impact on our health. Hippocrates was one of the first to talk about this. If you read some of his old notes, going back to 400 BC, you'll see he noted how there was changes in the weather systems, and changes in the weather systems, they saw outbreaks of disease. And then you move forward to 1814, Dr. James Tilton was a Surgeon General of the US Army, and he directed all hospital surgeons to take measurements of weather, meteorological measurements. So what they understood at that time was, with an increase in temperature and changes in precipitation, they were seeing outbreaks of disease, especially malaria. And they didn't necessarily know the relationship between mosquitoes and the spread of the disease, but they understood that with changes in temperature and changes in precipitation, they started to see soldiers getting sick. So how is it affecting our health today? So we have the direct and the indirect impacts of climate on our health. The direct are the things that happen immediately. Those are the things that send people to the hospital right away. Extreme heat, air pollution, extreme weather. When those events hit, you'll see a potential spike in the number of hospitalizations. Indirect are the things that sometimes take longer to manifest and longer to really understand. So that's the spreading of disease, the disrupting of food supplies, disrupting of well-being as well. mental health issues. And I'll talk about all these a little bit more in detail in a bit. We also know over the last century that extreme events, climate, has had major impacts on human health. We know that droughts have likely killed more people than any other climate or weather event internationally. That's mostly due to famine and malnutrition, but floods are a close second. But here in the United States, it's actually heat waves. Heat waves likely kill more people in the US than any other climate or weather related event. These numbers are, and we can talk a little bit about the number of fatalities and how we don't actually do a good job of calculating the number of fatalities. And I'll talk about that just in a bit as well. So heat waves here in the US are our main killer. But there's also a financial cost anytime one of these events occurs as well. So this is from 2004 to 2013. During that time period, hurricanes cost the United States almost $400 billion of economic loss. Heat waves and drought were second with almost $80 billion of economic loss, then followed by tornadoes and severe storms at almost $50 billion of economic loss. So will changes in our climate impact our health? Well, obviously, you can kind of already guess that. In 2016, I was one of the lead authors on a report that came out of the White House. It was called The Impacts of Climate Change on Human Health in the United States, a Scientific Assessment. It brought together experts throughout the federal government, academia, and the private sector. We had everything from medical doctors, nurses, to physicists, mathematicians, and you name it, working on this report. We had people from the EPA, CDC, Defense Department, NASA, NOAA, and a variety of other institutions and agencies as well. And the whole reason, or the whole purpose of this report was try to understand the impacts of climate on human health and what does climate change mean to human health as well. And so there's a number of findings that came from this document, but there were two main findings that I'm going to bring up right now. One, climate change is a significant threat to the health of the American people, and that every American is vulnerable to the health impacts associated with climate change. And that was a consensus based off of all the different people that were a part of that report, and also the different institutions and agencies that did review of that report. And so I'm sure some of you have already seen this particular figure. It comes from my colleagues over at CDC, and it just shows all the different ways that changes in our climate system impacts the environment around us and how those changes can potentially lead to human health consequences. And what I want to focus on, as we talk about more extreme weather, rise in sea level, increases in CO2, changes in temperature, I want to talk about these factors up here a little bit more. Environmental degradation, which can cause forced migration, civil conflict, and mental health issues. Extreme heat, which can lead to heat-related illness and death, and then cardiovascular issues. And then severe weather, injuries, fatalities, and mental health impacts. And so I'm going to focus on that a little bit more of the rest of my lecture, kind of illustrating some of those relationships and what that means for the vulnerable populations that are potentially affected. So this diagram I like to put up here because it basically takes that circular spinny diagram and makes it a little bit more linear. And it also adds two other components to it. So here, up at the top, we have the climate drivers. We have our changes. That was the central spinny circle that we saw in the previous diagram. Then you have the exposure pathway. That's the environmental exposure. That's a change in the environment. So that's the second wheel in the previous diagram. And then you have the health outcome, and that was the outer part of that diagram. And as you can see, there's kind of a straight line there. But one of the things that we realize is that not every time we see a change in our climate system or an extreme weather event do we see the same human health outcomes. And that's because of the two gray boxes on the outside, the social and behavioral context and the environmental and institutional context. Those things influence the number of health outcomes that we see. By social and behavioral context, that's what the makeup of our community is. Those are the people that are living in our community. what is the age, gender, race, ethnicity? What are underlying poverty issues? What is the housing, the infrastructure of housing? What is the education level of the people in that community? What's their access to care? What kind of discrimination is potentially taking place? What are the pre-existing health conditions as well? So, and then you go over to the other side and you have the environmental institutional context. That's land use change, ecosystems change, the infrastructure, what kind of geography, what kind of agriculture is in that community, in the surrounding area. So that is more of the physical makeup of the community. What is it actually, when you go driving through a city or a town or an area, what does it actually look like based off of the physical structure of that community? And all these things have a direct impact on the number of health outcomes. These are also the things that we can influence in some way, by building resiliency within our communities, by understanding who are the vulnerable populations, and providing the resources that are needed to those populations. So when an event occurs, we could potentially dampen or reduce the amount of the severity of the impact and the number of people that die or go to the hospital. And so, as you heard before, with one of the main findings from the report was that all populations are vulnerable in the United States and across the globe, but certain populations are more vulnerable than others. And that's typically the four that we have here. We have communities of color, children, low-income communities, and older adults. And there's a variety of different reasons for that, why these particular populations are more at risk to climatic events and extreme weather and climate events as well. It can be everything from pre-existing health conditions, access to care, discrimination in the population, potential risks because of exposure, because of either occupation or activities that the people are involved in. There's a variety of different reasons for that, but these are typically the four groups that are most at risk when we talk about climatic disasters. So the impacts of climate change are now. One of the things that I tried to focus on, earlier in this lecture, is sometimes, when we talk about climate change, people think about it in the context of 50 or 100 years into the future. And one of the things that we need to start thinking about is how climate change is impacting our health now, how climate change is impacting our communities now, because we're already seeing changes in our climate system. And we've already seen those changes over the last 50 to 100 years. So here, this diagram just shows the scientific evidence for human-caused climate change and how it's increasing some of these particular extreme events or climatic disasters. So heat waves, we know we have very strong evidence that climate change, anthropogenic climate change, is influencing heat waves currently. Like the heat waves that are happening now are more intense and longer lasting than the ones that happened 50 years ago because of anthropogenic climate change. Coastal flooding, we also have very strong evidence. Extreme precipitation, winter storms, droughts, the evidence is still strong. Hurricanes, we have moderate evidence of understanding the relationship with hurricanes. And then tornadoes, there's still limited evidence showing that relationship between anthropogenic climate change and tornadoes and some of those types of severe storms. And so how do we know this? What do we know? Well, going back to those models that we were talking about, and how we understand the physics of our Earth system, one of the things that we can do is when you run the model, the climate model, you can see that with an increase, we run the model and we run it with the forcing, anthropogenic forcing, and the model fits really well with what our observed temperature is. But then we run the model without anthropogenic forcing. So we remove that change in our greenhouse gas emissions. And then we see pretty much a flat line in the change in temperature over the last 50 to 100 years. So with that, we can actually try to determine the difference between an extreme event that happens up here versus an extreme event that happens down here without anthropogenic forcing, with and without anthropogenic forcing. And then we can understand how much more intense and how much more longer lasting that particular event was because of that, because of climate change, because of changes in our climate system. And so this figure just kind of shows our confidence in looking at a particular, this is where science is starting to evolve and change pretty rapidly. Historically, when somebody would be like, well, is this particular extreme event that's happening today, is that caused by climate change? We would say previously, no, that particular event, we don't have the evidence to show that that particular event is caused by climate change. And even today, we can't say for sure that that event is caused by climate change, but we can say that that particular event is maybe more intense or longer lasting because of climate change. And with that, we know that like extreme heat events and extreme cold events, we have very high understanding of the influence of global warming on an individual event. Droughts, rainfall events, a little bit less, and then we move on down from there. And I'll talk about that a little bit more in depth here in just a second. So with extreme heat, we know that we've seen a change in extreme heat events. We've seen an increase in the frequency and intensity of extreme heat events. This is work that I've been doing. Here in the United States, we've seen, especially since the last 50 years, an increase in the intensity and frequency of extreme heat events, which means more higher temperatures, higher humidity, longer, more frequent heat waves. They cause heat stroke, dehydration, heat-related illness. They can also cause renal issues, kidney issues. Vulnerable populations are outdoor workers, student athletes, people in cities, people without air conditioning, people with chronic diseases, pregnant women, older adults, and young children. And so that's also the next complexity of this. When we're talking very broadly about a climatic event or a climatic disaster, there's the four major subgroups of people that are potentially impacted by a climatic event. But when we're talking about an individual event in an individual community, it gets a little bit more complex. And so that's why we have to break it down by these higher categories of vulnerable populations. And again, why is this so important? Well, we know in the United States, especially, that extreme heat events are likely the #1 killer when it comes to climate and weather-related events. These numbers are actually probably quite low. We probably aren't doing a good job of capturing the number of people that are dying in the United States because of extreme heat, because these are all directly heat-related illness. We're not talking about all those other people that maybe fall through the system or fall through the cracks. So somebody that shows up with a cardiovascular issue, somebody that shows up with respiratory issues associated with extreme heat. Those are the ones that are typically not captured in these numbers, so the numbers are obviously quite low, and also one of the reasons why reporting is so important. And so in 2003, some colleagues of mine from the UK did a study looking back at the 2003 heat wave. And during that particular heat wave, there was a very intense heat wave that hit Europe. It caused at least 35,000 deaths. And my colleagues from the UK were actually able to look at that heat wave and the influence that anthropogenic climate change had on that heat wave. And one of the things that they were able to find was that heat wave was more intense, longer lasting because of climate change, because of anthropogenic climate change. And then they also went back to the medical records and looked at the number of deaths that occurred in Paris and London and found an association between temperature and the number of deaths, and then realized that it was about 70% of the deaths that occurred in Paris and 20% of the deaths that occurred in London were likely due to the fact that that heat wave was more intense than a heat wave that would have occurred without anthropogenic climate change. So then kind of moving forward, we talked about extreme heat, but we also have extreme weather. Extreme weather events we have the increase in the frequency and severity of downpours, flooding rains, droughts, and other major storms. They can cause injury, illness, displacement, and death. Vulnerable populations are basically anybody that lacks access to evacuation routes, people who can't use stairs when the elevators are out, people in wheelchairs, older adults, the poor, people with disabilities. And one of the things that we're starting to see is these types of events happening one after another. And this is one example here where in St. Louis, Missouri, they had a very significant and very impactful drought in 2012. And then the next year, they had a very significant flood in 2013. And when you see these types of events occurring one after another, it doesn't give a community a lot of time to rebuild and repair. So the impacts can be more significant. And we also know that the costs are potentially increasing with these events as well. And so this is from NOAA. These are billion-dollar disasters. These are disasters that exceed $1 billion of economic loss. NOAA has been calculating these going back all the way to the 1980, moving forward. And one of the things that you'll see is that we've seen an increase in the number of billion-dollar disasters across the United States. This is partially because extreme weather events are more frequent and more intense today than they were back in 1980, but also because things are costing more. People are moving to areas that are more susceptible to these climatic events. And also there's aging infrastructure that is potentially being impacted in some way by some of these climatic events as well. And so being here in Nebraska, we're definitely familiar with this. In 2019, we saw significant flooding throughout the Central Plains region. And each time some type of event like this occurs, there's a possibility for impacts on healthcare in a variety of different ways. With this particular flooding here in Nebraska, we saw at least 2 hospitals that sustained damage because of the flooding. There was at least a dozen long-term care facilities that were evacuated across Nebraska. And the access to care was a major issue as well. With flooded roads and damaged infrastructure, it became more difficult for people to actually get to healthcare and get to the hospitals that needed that help. And then on the opposite end of the spectrum, I talked a little bit about how more rain potentially causes human health. Well, like we saw before, droughts have killed more people killed more people internationally than any other climate or weather-related event. And droughts also have an impact on human health here in the United States as well. This diagram just kind of quickly illustrates the impacts of drought on human health. So over here, we have the drought event itself. We have the exposure pathway, which can potentially mean more dust storms, more frequent and more intense wildfires, changes in water quality and quantity, changes in the intensity of heat waves. We know that a lot of times when you have a drought event, a heat wave becomes more intense. We know heat kills more people in the United States than anything else. Changes in vector habitat, which sometimes we don't always think about, but there's a number of examples of that. And then agriculture and food security issues. And all of those things can lead to human health outcomes. And again, it all depends on the social and behavioral context and the environmental and institutional context and how we get to those human health outcomes. So one of the things that a lot of times we don't think of, especially when we're talking about drought, is the spread and changes of disease habitat of some of these diseases. So higher temperatures, changes in precipitation patterns, and disrupted ecosystems can lead to the spread of diseases, especially vector-borne diseases. So Lyme disease and West Nile, for example, here in the United States. And I know that we've talked about that to some extent before. Vulnerable populations are basically anybody that spends any time outdoors that can come in contact with some of these insects. And one of the examples that I like to talk about is the Zika virus outbreak that happened in Central and South America. back in 2016. During that time period, we saw this significant outbreak of Zika virus, which is spread by mosquitoes, and it occurred throughout that region. It became even a threat here in the United States as well as it was moving northward. One of the things that a lot of people forget about, and there's been some studies that have shown this relationship, that there was actually a very significant drought that was occurring, especially in Brazil and northern South America and the Caribbean and Latin America as well. That particular drought had a significant impact on the mosquito populations. It actually caused for more mosquitoes to be present in urban areas. And sometimes when we think about drought, we don't necessarily think about mosquitoes. We think about rain and mosquitoes. But what happens during a drought event is that you have pooling of water. Mosquitoes prefer puddles compared to flowing streams. So you have this pooling of water, and then you also had, because it was so much drier, people were storing water near their homes. And then right there near your home, you have this open water container that is a perfect breeding ground for mosquitoes, and is a perfect place for this kind of disease to transmit. You also see other diseases associated with climate, everything from influenza, is a seasonal disease, to measles and cholera, all have some underlying climatic variable that influences the outbreaks of those diseases. And air quality is another big issue, especially when we're talking about extreme events. Droughts can lead to wildfires, which can lead to reduced air quality. We also see things like smoke, smog, and pollen and mold. Mold, especially for indoor air quality issues after flooding. Anybody with asthma, respiratory issues, and allergies could potentially be exacerbated by these conditions. And here in the United States, we're definitely susceptible. In the western part of the United States, we've seen an increase in the wildfire season by over 78 days. The duration of wildfires has been much longer, and we've also seen, again, more intense wildfires. And as Dr. Bernstein had talked about earlier, wildfire smoke, even though the wildfire itself is very impactful for that region, the smoke can move for hundreds, if not thousands of miles away from the fire and lead to air quality issues for a long distance. And so here's one example. Each of these red dots over in the western part of the United States is a wildfire that was reported by NASA. And then this all throughout here is wildfire smoke coming from those wildfires. And this was back in 2018. And so you can see the potential for that. And then you have the mental health issues. When any time that you have an extreme weather climatic event, you have displaced populations. You have populations that have been impacted in a variety of different ways, economic issues as well, which can lead to stress, depression, anxiety, PTSD, and suicidal thoughts. Vulnerable populations are pretty much anybody that is in the pathway of these events. And we even see that here in the United States, again, going back to drought events, because that's an area that I'm definitely have interest in doing a lot of work on. In Australia, they've seen an increase in suicide, especially in rural communities, when drought events occur. Here in the United States, we've actually seen similar results when we see major drought events that have happened historically here in the United States. We've seen increases in suicides and mental health issues in rural communities. That's partially due to a lack of access to care, and then some of the other underlying issues that we have with dealing with mental health, especially here in the US. And then we have displacement and conflict. When a major event like this occurs, we can see people moving out, mass exodus, similar to what we're seeing here with, this was Hurricane Maria hitting Puerto Rico, which caused hundreds, if not thousands of people to migrate out of Puerto Rico to the lower 48 of the United States. And the example that I would like to give just very briefly is the Syrian conflict. This particular event has killed over 400,000 people, and has led to over 5 million refugees. And one of the things that I just want to quickly preface here is that, because I'm going to talk about the climatic link to this, climate in no way caused this particular event. What caused this event was the political structure and some of the social issues that were occurring in Syria. But climate was probably one of the underlying triggers that helped push this event forward. There was a very significant, impactful drought that was hitting the Middle East before this particular conflict, before this civil war. What basically happened was there was a strong drought. The strong drought was really hitting the rural areas and the agricultural communities hard. Those communities could no longer sustain. You had a large portion of the population that had lack of access to food and various other resources that they needed. They started moving to urban areas, still couldn't find the resources that they needed, and so you had a disenfranchised population, and that disenfranchised population was met when they started protests and complaints with a very authoritarian government that led to civil strife and civil war that followed. But when that type of event occurs, there is the potential for significant impacts that don't happen just there in Syria, because then those populations had to flee to other parts of the world as well. And so going back to it, climate change is local. The impacts of climate change do affect us here locally. Why should healthcare and public health care about climate change? Well, the first concept is do no harm. We see hospitals and a lot of other institutions leading the effort for trying to transform these issues, because we see what has been happening even places like here at the University of Nebraska Medical Center. We've been switching over to renewable energy to try to improve the health of our community here. Their philosophy is, if they're a hospital treating the community, they shouldn't also be the cause of potential health issues in the community as well. Healthcare and health-related sectors should also invest in preparedness for climate change. Preparedness is definitely key in trying to deal with some of these potential issues and protecting the vulnerable communities to the potential threats that they face. We also have to invest in education and training for the next generation of healthcare professionals, like what is happening here. Because it is important for people to understand, especially healthcare professionals, understand this significant threat to our health as we move forward. And so just kind of reemphasize that we need to help educate the public. We need to help enhance monitoring, especially in our local communities, so we know who the vulnerable populations are. We know how to potentially reach out to those places and how we can potentially build resilience within our communities. We need more research to understand some of these linkages between these extreme climatic disasters and human health. And we also need to start contributing to the public dialogue more and be advocates for some of these issues, and making sure that healthcare and public health has a stake when these issues are brought up. So closing thoughts, climate change is a significant threat to our health. All people are vulnerable, but some are more vulnerable than others. The costs associated with these climatic disasters are increasing. Multiple relationships between climate and health. There's still a lot of work that needs to be done, and there's a lot of work that needs to be done in bringing in multiple expertise to help with these issues as well. And so with that, if you haven't had a chance, please take a look at the report that we released back in 2016. And if you have any questions, I'll be happy to address those.
Thank you so much, Dr. Bell. While Natalie is aggregating questions from our audience, I was hoping to ask you a two-part question. Just briefly, could you tell the students what you do at Nebraska and why you were brought there? And then my question for you would be, you work with med students there as well. What is your charge to them as you're teaching them for how to take this information, this public health knowledge about disasters, and incorporate it into their learning as they move forward to become our future doctors?
Yeah. So to start off with the first question, basically what happened was University of Nebraska Medical Center reached out to me through various contacts and asked if I would apply for the position out here. They wanted to start working on ways of integrating climate change both into the College of Public Health, but also across the campus as a whole. And the reason for that was, and one of the reasons I was interested in it, there's a lot of work that's being done in the coastal regions. And, you know, honestly, my personal thoughts were, if I worked in, you know, California, Washington, all these other areas, there's a lot of work that's already occurring. You're just a drop in the bucket. You're potentially not moving the meter very far, but there's a lot of opportunity in places like this here in Nebraska to try to help integrate climate and climate change into some of the conversations. Because, you know, one, institutions like this at the University of Nebraska are educating the future physicians, nurses, and other public health and healthcare experts that are going to be treating the populations out here. And so they can serve as a voice to help with potentially sharing this information. One, because especially places like here in Nebraska, there's not a lot of exposure to PhDs like myself. However, there are a lot of opportunities for medical professionals to integrate and talk with those populations. So I think that that's one of the things that became very important. There's also a lot of work that still needs to be done on understanding the impacts of climate on human health here in places like Nebraska. What does it mean when a heat event happens here? Because our populations are obviously a little bit different than populations in Georgia, California, or other parts of the United States as well. And then when it comes to working with the medical students, actually, you know, when I first got here, I asked, you know, are there student organizations? What about working with medical students? And originally people gave me a lot of pushback, and they said, you know what, medical students at the University of Nebraska, especially medical students, you know, just in general, they're very, you know, they've got so much going on. Something like this really isn't an issue that they're interested in. And I was like, well, you know, as I move forward, hopefully we can start working on chipping away at that. And the next thing I know, within a year of being here, medical students came and reached out to me because they wanted to start an organization here on campus that started working around some of these issues. And that became very hopeful that there was already an interest within this, within the student population here. And so we're doing a variety of different activities, everything from community engagement to trying to better understand the impacts of climate change on human health to research. There's just a whole slew of different things that are taking place. And that gives me a lot of promise and a lot of hope for the future, because a lot of times, like I said, people kind of neglect to think about this region of the United States as an opportunity to address and deal with climate change. But we've already got people that are actively engaged and interested in this area out here.
Thank you. Natalie?
Thank you so much, Dr. Bell, for sharing with us today. I found your talk incredibly fascinating and enlightening. I have a few questions of my own first to get it started with. The first is a little bit sort of, I don't know, arcane, less about public health, but I was curious, you mentioned the core temperature record that you had. So to see the sort of fluctuations of climate change over the last several million years. Mm-hmm. I was wondering, is there any way in that sort of core ice piece to see when there were more droughts or floods or any sort of like climate extreme weather events? And if so, have we ever in the past seen an increase in extreme weather events during higher or lower temperatures in the Earth's history? And if not from that type of geological record, perhaps from a written record, although I don't know how far the written record really goes with this.
Yeah, so first off, yeah, those cores kind of act as like a basic snapshot, and there's a variety of different cores. So there's like the Vostok ice core that is best for determining things like temperature and CO2 concentration in the atmosphere. And then there's other cores like sediment and tree cores that we could potentially use that help give us a better understanding of changes in precipitation patterns and changes in other patterns across the globe as well. One of the things that it should be aware of is that as our climate system has matured over millions of years, it has gone from more violent oscillations to a more stable system. And since the presence of like modern day and man, our climate system has been fairly stable. We haven't seen large changes in our temperature and precipitation patterns, with some exceptions. However, as we move forward, we've seen a pretty remarkable increase in temperature, and our climate system seems to be becoming more abnormal. And so a lot of my climatologist colleagues will call this it's not the new normal, it's the new abnormal, because things are more frequent and more intense than what we've seen in the past. Does that answer your question?
Yeah, thank you. I have another question as well. You mentioned sort of the devastating impact that something like a drought can have in the United States, center of America, in terms of huge crop losses and family economic losses. And so one of the questions I have is sort of general: how can we better prepare for these disasters now that we know they will happen? And specifically, is there some sort of way to use climate models to predict better for populations like farmers or for the elderly who are in places without air conditioning when we will have a climate disaster, so that we can warn people in time? Are there any systems like that going on in place right now?
Yeah, and there's actually a lot of different, a lot of work that's going on, especially at the public health level. The Centers for Disease Control, for example, is providing funding to state and city public health departments across the United States to try to understand the impacts of climate change on human health. And they go through what they call the BRACE framework. So it's building resilience against climate effects. And basically it's first, researching, this is like the abbreviated version. So first it's researching what are the impacts of climate change on your populations. What are some of the current strategies that you're using to try to reduce those potential impacts? So for example, if like extreme heat events, are you using cooling shelters? Are you messaging? What are you doing? And then evaluating how well those procedures work, and then taking it one step further and trying to implement new procedures, and then evaluating that, and then it goes through the entire process. So that's kind of like the short gist of it. So first off is, like I said, researching, understanding who your vulnerable populations are, how are they being impacted by climate change. Second is identifying some of the strategies that are already out there. So for example, with like I was saying, with extreme heat, cooling shelters, making sure that they're in cooling shelters are in locations where they're actually needed, where you know that you have a larger vulnerable population. Doing messaging, making sure that messaging is getting to the right populations and being implemented in a way that it reaches the number of people that need to be needed, or need to understand it. So those are just some of the examples, but there are a variety of different examples out there, and there probably needs to be more data sharing, more information sharing on strategies that actually have been effective in other communities, and how we can implement those and try to implement those across the US as well.
Wonderful, thank you. Do you know specifically whether or not something like the drought that affected the farmers is predictable in an advance time enough to allow preparation, either economic preparation or irrigation preparation of any sort? Or is that just too much detail to know?
With a lot, so we know a fair amount about our climate system, and we do fairly well at short-term predictions. We're not as good in the midterm,
Okay.
like predictions. So like with for example, tornadoes, like usually, what is it? I think 15 to 30 minutes of warning, depending on you can give you there. Drought, is a little bit more of a complex issue. You can kind of forecast it out and start to put in different procedures to try to deal with drought. A lot of states already have drought mitigation plans, drought action plans, and some states are developing climate action plans as well to know how to deal with climatic events. And these are basically plans that when a drought happens or when a climate event happens, here are the people that need to be contacted, here are the people that need to do what, and how they need to respond. And so those are some of the things that probably should happen across the United States as a whole. And that's where policy comes in to some extent. One, states developing climate action plans so that they know how to act when one of these climatic types of events occurs, which each state has an emergency preparedness plan, but just understanding it in the context of climate change as well. But then also developing drought action plans and knowing how to implement those plans. Typically, states that have seen these things time and time again are more likely to have plans in place so that they can reduce the impacts the next time that they occur.
Thank you.
Thank you. It makes you think too how doctors' offices could do the same kind of action plan for our patient populations and recognizing the risk factors that our patients have, how we can be proactive about reaching out to them in these times of extreme events too, as a future model. And some practices are already starting to do that. It looks like we're over time. We ran over a little bit. I'm sorry for keeping you so long, Dr. Bell.